Airway suctioning. Definition: it is a procedure that is done in a mass care setting, including acute, subacute, long-term, and home setting. So the purpose of this procedure is to remove secretions from the respiratory tract that obstruct the airway to prevent infections that may result from accumulated secretions. So the equipments that we're going to use are the towel, the sterile gloves, the sterile water, suction catheter kit, the sterile disposable catheter, and the suction machine. So considerations before, during, and after the procedures are to introduce yourself to the patient, check the patient respiratory status, and check for clinical condition of the patient and possible adverse effect or adverse event that may occur with suctioning. So things to document after procedure is to document the procedure that were done and the findings, and also the observations that were gathered. So without further ado, let's start the procedure. So first, determine the need for suctioning. This is to assess for clinical signs. Now explain the procedure to the patient. So, sir, I am Siti Bashma Demorin, and I'm your nurse for today. And I'm going to suction your airway. Is it okay with you? So this decreases anxiety and facilitate cooperations. So next is to prepare the necessary equipment to listen the time and turn down the suction device on. Now wash hands. Supposed to be that I have already washed my hands, and now place the patient in a semi-folder's position to facilitate the insertion of catheters. Now place a towel on over the patient's chest. This is to absorb any leaking fluids. And now put on clean gloves, designed one hand as clean and the other hand as contaminated. So this is to maintain the sterility of suction catheter, and unsterile gloves prevent transmissions of organisms. Now using the clean hand, pick up the suction catheter. And with contaminated hand, attached to suction catheter to the connector. Turn on suction machine and test patency with the saline solution of sterile water. The glove finger applies to the part of the connector or the Y connector to create suction. So naso oropharyngeal suctioning. So gently insert suction catheter either through the mouth or the nose, with the suction off by keeping the port open. The catheter is never forced against on obstructions. So, now, once the correct position is ascertained, suction for 5 to 10 seconds by gently rotating suction catheter by rolling it between the thumb and forefinger while slowly withdrawing the catheter. This is to ensure that all surfaces are reached and trauma is prevented. Now release suction and withdraw catheter properly. Withdraw catheter completely. Flush catheter with saline. Flush catheter with a saline solution or sterile water to remove any secretions. Repeat suctioning as needed and according to patient's tolerance. Applying suction for too long may cause secretions to increase or may decrease the client's oxygen supply. And now for the endotracheal and tracheostomy tube suctioning. Hyperventilate patients' lungs with a resuscitation bag before suctioning. This is to help prevent suction hypoxemia. Gently insert catheter either through the endotracheal or tracheostomy tube with the suction off by keeping the port open. This is to prevent tissue trauma and oxygen loss. Suction is not applied during the insertion of catheter. Now insert the catheter about 6 inches for adults or less for pedia, or until the patient coughs or there's a resistance. It is usually means that it has reached the bifurcation of the trachea. Now suction for 5 to 10 seconds, gently rotating catheter by rolling it between the thumb and the forefinger while slowly withdrawing the catheter. And this prevents tissue trauma by minimizing the suction time against any part of the trachea. Now release the suction and withdraw catheter completely to minimize the oxygen loss. Hyperventilate the patient to help prevent suction hypoxemia. Flush the catheter. Flush the catheter with a saline solution or saline water, and this is done to achieve clean passage of an air. Repeat suctioning as needed or according to patient's tolerance. Allow 2 to 3 minutes rest in between suctions to provide an opportunity for reoxygenation of the lungs. While suctioning is completed, turn off suction machine, detach catheter from suction tube, remove gloves, and dispose safely and properly. Now, place patient in a comfortable position assess the patient, assess effectiveness of suctioning by auscultating and observing breathing patients. Now finally, chart the time, the characteristics of secretions, and the patient's reaction. So that will be all. Thank you.